you when you dance, dance, dance. Feel good, good creeping up on you, so just dance.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties above the fruited plain. America, America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea. Oh, beautiful for pilgrim feet whose stern impassioned stress a thoroughfare for freedom beat across the wilderness. America, America, God mend thine every flaw. Confirm thy soul in self-control, thy liberty in love. Oh, beautiful for patriotry that sees beyond the years. Thine alabaster cities gleam, undimmed by human tears. America, America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea. From
Ladies and gentlemen, welcome to the 2019 ASCP Annual Convention. Please welcome to the stage CEO of ASCP, Dr. Blair Holliday.
Well, good afternoon. We are thrilled to have you here in Phoenix. Welcome to the 2019 annual meeting for ASCP. This is going to be a week you will never forget. I hope you enjoyed the video. Some of you probably recognize yourself. It's a montage of you, the change makers for this organization. You're the members, you're the leaders, you're the individuals that brought this community together. Now, we've had some amazing experiences, haven't we? But when we use the word don't throw it away, what I mean is take these memories forward and pass it on. Make sure you remember that your job is not to forget the past, but to pay it forward to the future. And by the way, give it up and again for the Mountain Ridge High School Chamber Choir. Weren't they incredible? I can't think of a better way to pay homage to 9/11 on this day to remember how we can celebrate our country. Thank you again. Now, we've created a phenomenal program for you today, and over the next couple days, you're going to have an opportunity for special activities, both through education and other kinds of meeting and greeting sessions. But I need to start by thanking the chairs of the ASCP Annual Meeting Education Committee, and those are Dr. Amy Chadburn and Dr. Mamatha Chipola, all who've done the work, the heavy lifting to get this particular educational meeting off to a start. Please give them a hand of applause. You know, it takes a huge team of volunteers who work diligently throughout the year to bring you that latest, greatest, cutting education to keep you at the forefront of pathology lab medicine. And I can't ever emphasize enough that you as a specialty society, you as an organization, are stronger together because of your diversity, because of your backgrounds, because of your expertise in the field of pathology and lab medicine. All of us together, physicians, non-physicians, all of us together collaborate because we are the team. Thank you. The work that you do as pathologists and laboratory professionals is the reason why diagnostic medicine exists. And we, as those professionals, have an interrelatedness, don't we? We have the reason why patient care exists, because you are at the heart of it. And over the past decade, your organization, ASCP, has been forging deeper connections all around the world, those connections that are compassionate and those connections that bring the healing that we have, the liberty have in this country. So I'm very excited today to introduce you to our guest speaker. She, like us, is someone who values the importance of human connections. She, like us, has shined a spotlight on the global fight against cancer and emphasizes the role, just like you do every day, in the collaboration in that effort to make sure we make a difference. So with that, I'm honored to welcome somebody who is a good friend of ASCP, is one of the world's most powerful voices, but also one of the most powerful female voices who supports the global fight against cancer, who supports the need to focus on non-communicable diseases, none other than Her Royal Highness, Princess Dina Mired of Jordan. She is the current president of the International Cancer Control, of the Union International Cancer Control, and she actually is the first non-physician to hold the post as president in the history of that organization in Geneva. And as a testament to her outstanding leadership, she's also the first Arab to have been elected to this prestigious post. It happened in 2018, and her term expires in 2020. Now, who is the Union for International Cancer Control? They're actually the largest organization solely dedicated to reducing the burden of global disease as it relates mainly to cancer, integrating cancer control throughout the world, and doing it with an agenda to bring us together. Princess Dina is the mother of a cancer survivor. She's been a trailblazing force behind the King Hussein Cancer Center in Jordan. She served as the Director General of that center for 15 years, transforming a nonprofit center into an internationally well-known global organization to help folks affected by this disease. So to say that cancer is her baby, it in fact is. And she is immensely proud of the influential opportunities that she's been able to help all of us connect to support the advancement of treating cancer. She's also a leading figure for advocating for early detection of breast cancer and cervical cancer in Jordan, and she served as the honorary chairperson for the Jordan Breast Cancer Program from 2006 to 2016. She's been in many high-profile positions. And in 2011, she was honored to be chosen to deliver the keynote speech on behalf of civil society at the first ever UN meeting in New York on the high-level diseases and non-communicable diseases. And then in 2018, she was chosen again at the same third high-level meeting for NCDs as the eminent champion who has fought the fight on the prevention and control of cancer and non-communicable diseases. Now, on a personal note, Princess Dina, Her Royal Highness, has acknowledged that with her title comes great responsibility. But as you know, those to whom much are given, much is expected. As the parent of a son who was a cancer survivor, who was diagnosed as a very young child at the age of 2, Her Royal Highness feels privileged to be in a position to help other parents who love their children just as much as you love your children. And when her son was diagnosed with cancer, her daughter, who was only 4 years of age, also found it very tough for the entire family. They were very close-knit. They had an opportunity to offer support. So at the end of her son's treatment, Her Royal Highness learned about the enormous effect that cancer can have on siblings as well. She's talked about how important it is for entire families, schools to come together to support the siblings for patients who suffer with this disease. So she urges parents to seek out experts. She urges parents to talk to young siblings, and she urges you to talk about the age appropriateness of this disease. So from this experience, she's learned and she has determined that everyone can contribute. All of us can contribute against the fight against this disease, individually and as a community. So today, she's going to talk about how her vision can be our vision, and how we together collectively can transform and upscale the global cancer community to face this overwhelming global burden of this disease. And all too often, even with the best of intentions, you're going to find out that the global community is often not very united and often has no coordination in the support to deliver long-term sustainable solutions. So she's going to offer us her thoughts on those long-term solutions. She's going to offer how we can partner together to provide that nexus to make sure this disease doesn't affect future generations. So before we introduce her and show her, we're going to ask you to please consider focusing on this very important video. It's a video about the work of the Union for International Cancer Control and the collaboration that they have had with ASCP, working together on global disease to improve laboratory practices throughout the world, and ultimately, to strengthen patient care.
Had I been an underprivileged person in Jordan, I would not be able to call myself a mother of a cancer survivor. Are we going to be the generation that's going to just sit back and see 18.1 million new cancer cases every year and accept that 9.6 million per year die, and 70% of which in our own countries, in the developing countries?
She's a member of Jordan's ruling royal family. She's also the first Arab Muslim to take the presidency of the Global Cancer Control Organization, the UICC.
I will advocate fiercely on behalf of cancer patients day in, day out to make sure that where you live should not determine if you live.
The King Hussein Cancer Foundation has become one of the leading NGOs in the region for cancer care, and its transformation has been accomplished by a woman who campaigns tirelessly for better healthcare for cancer patients everywhere in the world.
And in the 15 years I spent as Director General of the King Hussein Cancer Foundation, as part of the team that oversaw the transformation of cancer care in Jordan, I saw and I experienced firsthand what political will, planning, organization, systemization, and hard work can achieve. We need to ask ourselves, what legacy do we want our generation to be known for? The one that watched the NCD epidemic destroy the lives of our children and our children's children? Or the generation that said enough is enough and took action? The weight of this seminal decision is on your shoulders. Our people, our children, young and old, male or female, will ultimately die unnecessarily from heart disease, cancer, diabetes, when simply all these diseases can actually be prevented. There is one undisputed fact, and that is there is no time to waste. Millions of cancer patients look to us for deliverance. Without the engagement of civil society, we will not be able to achieve any of the targets that we're supposed to achieve, and certainly we will not achieve any of the goals that we are all committed to.
As you can see, the Union for International Cancer Control is leading the way to fight cancer, reduce the global burden of the disease, and ASCP is proud to join forces with the Union for International Cancer Control on its ambitious initiatives. And now it gives me great pleasure to introduce you to the President of the UICC, Her Royal Highness, Princess Dina Mired of Jordan.
Good evening, everybody. Thank you very much for inviting me to be part of the ASCP family. I'm so honored to be here. And thank you also for bringing me to Arizona. I've only seen it in movies. Very happy to meet the cactuses. Wish I can take a few with me as we go back. They're beautiful. You, the pathologists, are the first. Really, you perform the first step in the difficult patient's journey. Without you, we cannot start treatment. I know that. I'm a mother of a cancer survivor. I know exactly the importance of pathologists and how important for you to get it right. While you may think you are the hidden soldiers, I know not many people see you sitting in your labs. I think here I see Dr. Maher, is that you? I acknowledge Dr. Maher, our wonderful pathologist, head of our lab at the King Hussein Cancer Center. He's here, lovely. You may think that you are the hidden soldiers, but please know we value you. We value what you do. We understand the importance of your work, and we understand how important it is for you to get it right. Otherwise, the patient's journey would not be the same. My relationship with ASCP goes a long way, with Dan Milner, with Blair Holiday, and you being a member of UICC. We've been crossing paths along the way through different conferences and through our work with UICC. So This is why I'm especially honored to be here, because you are such a great partner, and I really feel that you, the pathologists, have been really putting your weight behind cancer control and really putting your weight in filling the gaps, especially in the developing world. So I really thank you for that. Today, I know you're very much into details, you, the pathologists. You're always looking for the smallest detail, the cells and what have you, looking in your microscopes. But today, I really hope to take you out of that and give you a more of a bird's eye view of the challenges in cancer control, especially in the developing world. Just for those of you who may not know much about UICC, we are all about partnerships. It is in our DNA. We are a union of over 1,300 members from 177 countries, and we are proud to have ASCP as one of our members. What we do, we try to unite and support the cancer community, not only to reduce the global cancer burden, but also to promote greater equity, to ensure that everyone, wherever they are, they have the chance to live. We all know the current global cancer burden. We all know that cancer has been increasing and it's expected to double by 2020. The latest figures in 2018, we are talking about 18.1 new cancer cases with 9.6 million deaths. The worst part of this statistic is that 70% of those deaths are in the developing world, our world. Our sisters, brothers, mothers, fathers, cousins, they're all dying unnecessarily because they don't have the right tools and the right systems in place to be able to deliver cancer treatment for the disease of the century. And this is why what UICC is all about. We are as good as our members, yeah? And what you guys, as being one of our great members, all of us working together to respond to that. What we said, we don't accept this statistic. It cannot be that 70% of people are dying unnecessarily, where in other parts of the world, it really is a lottery of where you live. And we say, the chance to live should not be determined by where you live. So UICC and others, we responded in various ways. Before I became president of UICC, we as King Hussein Cancer Foundation and Center, we were members. We were active members since 2008. And I had no idea. I thought everybody was terrified of cancer like we are, and I really thought it was top of mind. I had no idea that cancer was not mentioned or acknowledged in the global corridors of the UN or the global health community. I had no idea about that. Later, only to find out that, and then it kind of explained many things for me. Because when I was working as Director General of the King Hussein Cancer Foundation, I would go, for example, to embassies to try to get some funds for cancer. I would dress nicely, put some lipstick, go to see the ambassador, come with my team, and all I end up with is a cup of coffee. My husband, on the other hand, who's in the, he was the ambassador for the landmines convention. And at that time, it was all about the landmines, clearing landmines and so on. He would go to the same ambassador, dressed very normally, and comes out with millions. And it explained that to me, because the non-communicable diseases were not acknowledged, there were no money for it. It didn't trickle down. We had to do all kinds of things to get money. We had to do galas and parties and walkathons, but there wasn't the money, ready-made for us to do things. But in 2011, the UICC joined with the NCD Alliance. They established the NCD Alliance with the Diabetic, Heart Federation, Lung Federation. They joined together because we all share the same risk factors, and thankfully, we were, for the first time, acknowledged in 2011. It's really unbelievable. Every time I hear it, I say it, it's quite incredible. And I think many people to this day don't know this. And we did everything that needed to be done for global advocacy since then. We've updated the cancer resolution, updated the essential medicines list, the political declaration, you name it. Everything that needed to be done, and the tools and the recommendations that we had to do for countries in low and middle income settings, we've ticked all the boxes. But in 2018, the first time, I was the younger version of me. In 2011, we were hopeful. Now it's going to be acknowledged, etc. We thought that, immediately things will change on the ground. But in 2018, when I was asked to speak again on behalf of civil society, I honestly didn't know what to say. I honestly didn't know, because not many actions really trickled on the ground. And I ended up just telling the members and the leaders at the UN, what else should we do? We've given you all we can, the tools, the recommendations. Why is it that, some countries, of course, did something, but why is it hasn't been a significant shift in actions? And why is it? Why the lack of action? What are the challenges? And I think access to quality care, I know we talk about it very in a blasé terms, we repeat it all the time, lack of access, but actually it is a much more complex issue in the developing world especially. I always compare it to an Olympic obstacle course. There's so many obstacles to go through before you reach quality access to cancer care. The cultural barriers, the stigma around that still exists to this day in many countries, where people still equate cancer to death. And you know what? I don't blame them at all. In Jordan, we had that before the success of the King Hussein Cancer Center. And it's very logical. When mostly people saw, before the King Hussein Cancer Center became a top cancer center, it used to be tantamount to a morgue, and people would just go there to die in 1997. And of course, if any of us would see people walking vertically to a center once they had cancer and coming out horizontal, of course they're going to have stigma, right? And it is the situation in many parts of the world. So cultural barriers, equating cancer with death, or maybe leaving it to fate, and so on, and other issues, that can stop you from access to quality care. The other thing is healthcare awareness and enabling environment. I was a victim of that when I was a mother of a cancer survivor, when my child got sick. At the time, imagine, we were in England, actually, because we discovered his cancer when our family went to join my husband while he was doing his PhD at Cambridge University. After both my kids had chickenpox, my son started to, display the symptoms that I had no idea about. In 1997, certainly a young mom with a kid less than 2 years old, the last thing in those days you think of is cancer. I went 5 times to the emergency room at the National Health Service, 5 times. And even then, the doctors in England had no idea about the symptoms of cancer. 5 times. Had I not called my doctor at the time back home, I was frustrated. I called my doctor back home, and I literally wrote the symptoms of leukemia without having an inkling that it is leukemia. I still have this paper to this day tucked away somewhere. So when you don't have health awareness, either by the patients or the people about the symptoms of cancer, or your primary doctors not having, you don't have access to care. Had we delayed going, and I remember my doctor told me, he said, you need to have a blood test. And in those days, when you're with the National Health Service, you can't just ask for a blood test. I went there without an appointment, and with my kid in tow, and he was crying, obviously, and still I didn't know he had cancer, and I said, we need a blood test. And I will pay, I just need a blood test. And the lady said, you know, this is not done in those days. You have to be referred and you have to do something. And she told me, well, you know, I'm very sorry, but you don't have an appointment. And then one kid who was 18 years old, Stephen Bewley, he stood up and he said, I think you can have my appointment. And that was then, by that time, of course, all the, you know, the platelets were so low. Then the doctor looked at it and said, oh, I think you need to go to Adam Brooks Hospital. And that's when our story continued. So again, you know, if I didn't do that step, God knows what would have happened. Then, of course, you have the obstacle, and this is here I seem to have spoken about that, the enabling primary healthcare knowledge, which I've just said. And then some people don't even have a cancer facilities. They don't even have that. So, of course, they're not going to have access. Let alone quality cancer treatment. We all know that cancer knows no mediocrity, right? You can't just have a little bit of an okay protocol or an okay pathology or a medium style treatment. You can't. You need a quality care facility. And then for those people who might have a quality care facility, they might not, they might live so far away. And actually at the King Hussein Cancer Center, there was a kid whom we covered through donations for treatment for hundreds of thousands of dollars. And he was doing so well and responding to treatment, and suddenly he disappeared. They called us up from the center and they said, he's not coming anymore. Only to find out that this kid who's been covered for $100,000 for treatment did not have the money for the taxi to be coming to and fro. And because of that case, we decided to add a program for transport from our Goodwill funds to cover people for transport. Again, you might not think about that, but it actually happens. Then, of course, people who don't have the money to pay for treatment. And Dr. Maher and I and others at KHC have seen those people. You know, I've just listened to, I can't remember which candidate recently who said, here with the US elections, he said something, it's very hard to hate up close. And you know what? It's very hard to see lack of access up close. It's very hard. One time a Yemeni father came, he apparently had only the money for his airfare. And when he came to the center, he just dropped his kid and ran away because there was nothing. He couldn't face the accounting department to ask if he has money for the treatment of his child. And many people said, oh, how irresponsible. And I said, you know what? All of us would do the same. I would do the same for my kid if I had to. And of course, we helped that child, collected donations, and tried to help. Lack of access when you see it face to face is just awful. It's like looking at someone, a child or a mother, who's looking to you and asking for help, and then it's like, you know, the magic potion is here that can save your life, but you know what? Not for you. Imagine having to say that up close. It's horrific. And we at the King Hussein Cancer Center and in Jordan, we always try to help over and beyond our capacity, because seeing it up close is very different than hearing the academic term, lack of access to care. It's a very different story. Then we don't have the barrier of psychosocial and therapeutic therapy support. That wasn't also available for people. Targeted treatment drugs, that's another new obstacle that we are now facing in many developing countries, where I fear that there's going to be a two-tier treatment, some for the developed world and some for the developing world. It's going to be like designer drugs, you know, for some and not for the others. And I really, truly hope that we can solve this issue and have more transparency on medication prices and so on, especially with regards to the latest WHO report. Survivorship care. Survivorship care, many countries, they only think survivorship care is, you know, when you have the cake and the candles and you clap for the child and you say you finished treatment. They don't understand, or at least governments don't understand or don't want to understand, that survivorship care goes beyond that. the side effects, the follow-ups. That's I know from my own child. And many governments don't want to cover that, the cost of that care. So many people don't even have that access. Palliative care, the same. And I find that really irresponsible by many countries because it's not a question about money, it's a question of bureaucracy. And politicians always have this answer, oh, you know, smuggling. Excuse me, you know, fix your smuggling, add money to your, you know, police and border, but don't take the really important medicines away from the patients who need them. Then, of course, patients' rights. And I think this is a big issue in many developing countries. We have some small NGOs who are working towards, you know, advocating for patients, but they are small and maybe they are working alone and in silos. They don't have the big influence that they should have. And it's growing, but we need them. We need to work more on that so that we can really advocate and become real pressure groups to demand access to care, to demand quality access care, to know what is our right and what to expect. And this is really, really important if we are going to move cancer care in all countries and especially in the developing world. The other thing, the other big challenge about all these obstacles to get access to quality care is lack of political will. Many leaders, the fact that, you know, they haven't, because the NCDs were never acknowledged, people focus more on malaria, AIDS, tuberculosis, and of course they are important diseases, we should not belittle them. But the fact that, you know, one was more important over the other, which was ridiculous or deemed to be, it made many countries very delayed in addressing cancer. And we all know how cancer is a complex disease. It needs expensive infrastructure. It needs not a normal nurse, you need an oncology nurse. Pathologists have to be specialized in oncology. Everything is much more complicated with cancer. So many leaders actually find it very overwhelming to deal with cancer. They don't want to open that Pandora's box. They are really overwhelmed. So that creates, you know, no action on the ground. But there is, sometimes it's not always about money. Sometimes it's really the lack of political will and a very irresponsible political will, which is they don't implement the regulations that they should, at least to stop the tap from running, right? To stop the leakage, to stop the avalanche of new cancer patients, like fighting smoking, sugar, excess sugar, salt, etc. All the things that we know can be done and that they can prevent cancer. We in Jordan are facing that now. Imagine we have a fantastic cancer center, one of the best in the world and in the region, yet the smoking rates are so high in Jordan. Just before I came, we were busy fighting the introduction of e-cigarettes. And it's a big, big battle because all tobacco industry is really moving away from America, Canada, Australia, coming to us, the Middle East, Africa, and the developing world. They're coming in a big way because you know what? We are not implementing the strong regulation, and that's really irresponsible. The other challenge is, which I think is very important, is the lack of capacity of governance, management skills, and planning. And you know, this was the case with us in Jordan. Imagine, before we started fixing, all of us, the team, the King Hussein Cancer Center, to fix it up, before that, we had the building, we had the machinery. We in Jordan pride ourselves. We have so many educated people. That's what we have in Jordan. We have highly educated people. Everybody has a master's and everybody has a degree. Why is it we couldn't put it all together? You know why? Because of governance, management, managerial skills. And during my time at UICC, I find that more and more, many of the issues of the developing world is not always about money only, but it's about management and governance. And which leads, by the way, when you don't have good management, good governance, you don't have the way of thinking to have planning. Many of them don't have plans. Many countries don't have cancer control plans or registries and so on. So of course, if you don't plan, you plan to fail. Lack of multi-sectorial work is another one. Many work in silos. Health ministries work in silos. We have laws that conflict with each other even. One ministry does something, the other one does another. And this is the case of many people in the developing world. And of course, that's gonna not help with national action. But then also the global community sometimes exacerbates this problem, even with the best of intentions. And what happens is they, unfortunately, sometimes they offer support at the wrong time, or just because there is a grant for something, they want to go and take that grant, or they want to take global health. It doesn't start from the need of that place or the readiness of the place they want to have. Again, with the best of intentions, and sometimes this makes duplication and sometimes wasted effort. And I know in Jordan, when we first started, we were bent on, we knew our priority, we want to fix treatment. And I remember one well-meaning organization for breast cancer came to us and she said, let's do breast cancer awareness. And we looked at that lady and we said, I'm very sorry, thank you very much for your help, but no. And they were aghast. And we said, we explained, and we said, you know, we're only going to focus on treatment right now, because if most people don't believe that they can actually survive cancer in the first place, how are they going to listen to us for early detection? We need to make them understand that they can survive it first, and then we will have the listening ears. And also, we don't have the resources to fix everything all at once. And that's exactly what we did. So when we fixed treatment, the center had the accreditation by JCI and so on. People started to believe they can actually survive cancer. We launched our Jordan Breast Cancer Program. And it is one of the best early detection screening cancer programs in the region, already halving the number of women who present themselves late. So again, the timing of the support, or what support, it's also very important. So UICC's response, what to do next? Now that we know the challenges on the ground, I mean, we did the global advocacy, we needed to think again, to make sure that some national action takes place on the ground. We needed to stop duplication, fill in the gaps, and we realized we have to go national or regional. We needed to walk the walk of a health minister in a poor country or a patient in a poor country to really understand why is it, with all the tools and the recommendations, nothing significant is happening. So we launched new initiatives, joined and established new partnerships, and launched new organizations. We launched the World Cancer Day in 2012, and this year, 4th of February, I know many of you joined as well with the I Am and Will campaign, and we're really amassing a big global voice. You know, so many thousands now of activities, and people utilize this day to lobby their governments. Slowly but surely, we are making a big presence, uniting the voice of the global cancer community. The next thing is we launched the Treatment for All advocacy campaign. Again, we did the global, now we needed to go local. And to do that, again, we go to patients' rights to really empower patient groups. The Treatment for All advocacy campaign goes national. What we do, we go to a city, we help and facilitate all the different NGOs who before they work in silos. We help them unite, sit on one table so they can have one voice, one ask, and one force to be able to lobby their governments. I know this sounds very basic, but actually it is so needed because many don't know how to coalesce together in an impactful way. Then we joined and established new partnership, and I know ASCP is one partner of the ICCP, which is the International Cancer Control Partnership. Believe it or not, before it seemed that there were 31 organizations doing the same thing globally, helping countries with how to develop and fine-tune their cancer control plans. Imagine, 31 countries, different people doing the same thing. So what happened, UICC and all these partners, including ASCP, joined together to form one partnership. UICC operates that program, and basically it's a one-stop shop. Countries they know where to go. All the capacity is there now because we have 31 people ready to support, and it's a one-stop shop, and already we have countries like Ukraine, the Maldives, and others joining in, asking either for development of a new cancer control plan or fine-tuning one. So again, joining to fill in the gap. Then we have the Global Initiative for Cancer Registry Development. Again, not many countries have that. Again, with IARC and others, we've joined and WHO partnership to also help countries and support them into developing their cancer registries, which is, again, as you might appreciate, very important. And of course, the beginning of joining a new organization to fill a gap is really the formation of the NCD Alliance between the Diabetic, Heart Federation, lung diseases, and cancer. And by the way, it wasn't an easy one. If you talk to the people at UICC when they started, it really wasn't an easy to get people to work together, because sometimes, as we all know, a lot of the donations make us work apart, right? They don't help us coalesce together. But they did it. And thanks to the formation of the NCD Alliance, now countries are talking about diabetes, talking about heart disease, which was never spoken of before. And now we have so many organizations now of patient organizations working on NCDs in many countries of the world. And they got us to the first UN high-level meeting, thanks to this new organization. Then we formed something called the McCabe Center for Law and Cancer. It's a partnership with Cancer Council Victoria in Australia, and really to fill the gap of how to use and utilize the law to advocate for health. And even things like fighting tobacco industry and so on, and because we felt there was a gap in that. And I know one of our lawyers in Jordan that has been helping us, his name is Mohammed Nsour, he's been helping us with our fight against tobacco now in Jordan. He went and got a lot of instruction at that McCabe Center, and he's such a valuable member on our committee. Then, of course, like I said, we needed to go local. We needed to put boots on the ground. Enough theory, enough global advice, that's important, but we needed to really, really understand what it's like. So we established a new initiative, a new program called the City Cancer Challenge. And it really was a new paradigm shift on how to operationalize cancer control in low and middle income countries. The key word is operationalize. And that's what's been missing all along, how to operationalize when you go in real life, in the city, and it's all its dynamics. It's all about implementation on the ground. And why did we choose cities? Because now many of the populations, urban populations, live in cities, 60%, so it's a good catchment area to do something. All in the hope of, UICC and you as members, all trying to fulfill and reach the targets of global health and development targets. And of course, in plain words, to save lives. When we started the City Cancer Challenge, we said, who will we work with? And we said we will only work with cities who agree to our core guiding principles. We said we will work with cities above 1 million to get a good catchment area and to have a good impact. We chose 4 key learning cities: Cali in Colombia, Asunción in Paraguay, Yangon in Myanmar, Kumasi in Ghana. And when we go to a city, before we choose them as one, we ask them, are you willing to invest in cancer? Meaning, do you have the political will to do something? Because quite frankly, it's a waste of time if there's no political will. So when they say yes, they move, they have a chance. Then we asked them, are you ready to work multi-sectorially, to sit everybody on one table? The patient groups, private sector, the mayor, the minister of health, and so on and so forth. If they are ready, we say, okay, you will be on the list. Do you agree to a patient-centered approach? Again, many of health systems, not only have they been long geared only to deal with communicable diseases, very reactive systems, they have never been a patient-centered. It was never really about what's comfortable for the patient, what it means. Are you ready to change your thinking? If they are, we say, okay. Why do I think the CCAN initiative is such an amazing approach? Number one, it starts with a plan. Again, I know it seems very simple, but believe it or not, many countries don't start with a plan. And you know, it is the business model, right? The logical business model. They don't start with a plan. And what I love about it is we give them a self-assessment tool prepared by the National Cancer Institute, actually, and basically to do their comprehensive gap analysis. Those cities, for the first time ever, those learning cities did a complete self-assessment to find out the gaps from prevention all the way to survivorship. Some cities had maybe over 800 technicians from pathology, from nursing, from this and that, top down, bottoms up, you name it, to fill this assessment. And this was the first time ever that this was done. Imagine how amazing that is. Then it focuses on management and planning skills. And this is, again, I cannot stress how important that is. Many countries in the developing world, they simply don't have the capacities at their health ministries. You know, for example, you might have a super smart health minister, and he really wants, or he or she wants really to do great work. But they don't have the right people at the ministry who he or she can tell them, you know what, we have an issue here. Can you go and strategize and have a fresh view how we can fix it? He doesn't have that. There are no capacities. So what happens at these ministries, all the workers, including the health minister, have absolutely no time to think. They are just doing day-to-day stuff, tasks, and meeting people and so on. So what happens is you end up having no management, no planning, no strategizing. And if they do, it's usually, you know, oh, in 2 weeks, let's revise something. When we all know sometimes it takes 6 months to look at one thing. And we get frustrated by that all the time. So the City Cancer Challenge makes sure it understands that issue and that gap. And the third thing is the city leads. It's not the colonial way of doing things whereby, you know, the North comes to tell the South what to do. No, it's not like that. It's the city leads. And the City Cancer Challenge team is the one that just facilitates. It's like having a free consultancy worth millions, but it's for free. And not only it's for free, it's from an NGO. So there's no agenda, but really to support. And they brainstorm together. And when I went, by the way, to one of the cities, I went to, thanks to this City Cancer Challenge, suddenly I was like, you know, a big worldwide traveler. I went to Cali, I went to Ghana, I went to Asuncion. And I saw in my own eyes the little wins that started to happen. It's amazing. First of all, I asked the people, the City Cancer executive team, I said to them, when was the last time you saw each other? Nobody put their hand up. Imagine the simple win of having everybody sitting on the table. One group, apparently, when they sat down, they made maybe something like 80 priorities. 80. They were so excited, there were so many things. The City Cancer Challenge team helped them to whittle it down. What do you want to do in year 1? What can you do in year 2? And so on. And one country, actually, Asuncion, just to give you an idea of the small wins, but they mean a lot. Asuncion, when I went there and I met the president and his wife, he didn't know much about really the power, the potential power of this program. And he said, and I explained to him how important to utilize this. Then we went to meet the Senate, etc. And apparently at that time, there was going to be a cancer law, believe it or not, in Asuncion that was going to be given to the for voting at the Senate, and nobody had seen it from the cancer lot. Nobody had seen it, imagine. So we explained to them that this is ridiculous, you can't do that. Now you have a city executive team. They are the ones who influence cancer policies and understand. Do something. So they froze the law. This year we hear not only did they give it back to the executive team and they fixed it up and so on, for the first time ever, the government in Asunción put 50 million investment towards cancer control in that city. So it really is making, it's not easy, but it's making waves. So they really facilitate, and what they do, the team, they facilitate with the team how to whittle it down from so many priorities they suddenly want to do, from the needs assessment, development of a strategy, action plan, implementation plan, even financing. We are developing a financing tool to help countries to deal, how to have innovative financing to finance their cancer activities. And then, of course, then we talk about a costed action plan and how to implement. And this is where UICC and ASCP, you've been part of that. This is how we come in with our 1,300 partners to say, look, to the global health community with the great intentions, look, this country has a plan. It's been thoroughly and very logically done and scientifically done. There are gaps. How would you like to help on one plan? And then, of course, the multi-sectorial partnership that we have, again, that's what makes this program very strong. You have everybody sitting on one table. Again, the CCAN also, what is important about it, it brings the partners at the right time, at the right time. So, like I said, UICC, ASCP, you guys have been really slotting in. I know you've done great work in Myanmar. I don't know, for those of you who don't know, in Myanmar, apparently, I'm told by the City Cancer Challenge team, because now it's become, by the way, its own, we've incubated it at UIC, we've established it, incubated it, and then we let it go as its own standalone foundation because it needed a different operating model for it to thrive. So we were told, I wrote to them before I came, I said, tell me, what were the most significant things that ASCP achieved? They said, for example, in Myanmar, they worked, one of your ASCP members, they worked with private and public pathologists there in the city to make sure that they work together. Apparently, it took 1 year to build that relationship, to build that trust. This is amazing because mostly private hospitals, they are the ones who have more capacity and maybe higher caliber pathologists and so on because they pay them more. So to have that, everybody, to have a collaborative group working together in a city, this is huge. This is a resource, and it required standardization from all the procedures and so on. This is amazing. ASCP, you guys have also been doing training, lots of training in Cali and others, because wherever you go, diagnostic capacity is really low, and you've been really championing that. And that's why I love the fact that you love working with others. You are happy to join when you see something good. You're happy to join and fill in the gap, and it's really amazing. And I was even thinking, by the way, also, apart from training you've been doing, you've been doing telepathology capacity, and I think that's in Yangon as well. And this is super amazing. Certainly, we at the King Hussein Cancer Center, remember Dr. Maher, it helped us a lot to have telepathology with different medical centers all over the world. Especially, actually, because people first, when we first started, they wanted to be able to know that we could get that very important second opinion. And it made people more comfortable. And it made people who had money to go abroad to stop going abroad because they knew we could have a very vital second opinion. So that's amazing what you've done with Yangon as well, and other cities. And I'm wondering, I was just thinking, I just thought about it last night. It'd be great also if perhaps you, the ASCP, could actually, like we did an essential medical list for cancer, maybe you could do an essential laboratory list. I don't know if you've done it. It might be good to do something like that, because many countries, and I think this was witnessed in Cali and others, suddenly they want to buy the most expensive machine for the lab, whilst they don't have somebody to operate it. At the same time, maybe that machine, it might have been cheaper to outsource that particular test because it's not that important. And Dr. Maher even knows, in Palestine, remember when I asked you, we were trying to help a laboratory in Palestine, and somebody told me, Princess Dina, you're good in fundraising, could you help us? I said, wait a minute, you have to be scientific. I'm gonna ask Dr. Maher. And then we find out that one machine costing God knows what, an arm and a leg, was absolutely not needed because down the road, 15 minutes, there was that machine. It would have been far cheaper for them to outsource that service. And many developing countries do that. It will be great. I don't know if it seems sensible or not, but it might be a good thing to have an essential laboratory equipment list for cancer, especially in low and middle income resource setting. That's just an idea. So, the CCAN team, they offer technical assistance, evidence-based, and for free. And this is what I kept telling leaders wherever I go. I said, you better utilize it. If I were you, I told them, I wouldn't just sit waiting for help. I'm the one who would be calling and making it fast because, we work with them for long term. We work for them for 3 years, hand-holding and supporting. I said, if I were you, I would make these 3 years feel like 4 years if you really appreciate that this is a really unique way of supporting a city. So I would like to thank you all, the ASCP, for being such great partners with UICC, with the City Cancer Challenge, and with joining all the other partnerships, because honestly, it's all about connecting the dots. We have a unique case in the sense with cancer. We know what to do. We know what needs to be done, but somehow everybody's doing things on their own, and the only way is really to join together. As cheesy as it sounds, the only way we can really impact and make a big difference is by joining together. Before you go, I would like to just tell you that there's going to be the World Cancer Leaders Summit in Kazakhstan in October. Many of you, I know Blair is coming and others from representing ASCP. It's going to be very difficult how to get there, but we're all very excited. And it's a big journey and a big detour here and there, but we're very excited. It's the first time in the region, and already we have really high-level leaders attending the summit, which is great to keep cancer on top of agenda. Then also, please, please save the date for the 2020 Cancer Congress in Muscat, Oman. And it's the first time in our region as well. Oman is a beautiful country, not Amman, Oman, beautiful country. And we hope also, and for the first time, we have done a track for oncology, medical, because many of the advocacy in our region actually is done by doctors. So we need, again, the technicians to understand that they can only work well once they understand the issues of the health system that actually either makes them work better or frustrates them, right? So we need to make sure that we're not all in silos, the pathologists alone, the doctors alone, the patient groups. It really is all of us together. So please save the date for that. And that's it from me. Thank you very much, and thank you for all that you do. Thank you.
Please welcome Dr. Holliday back to the stage.
Isn't she a force to be reckoned with? You are incredible. I'm going to let you take a few minutes and catch your breath, and we're just going to have a few minutes to have a Q&A here to discuss a few more intimate details about your work. But I'm going to start with a story. And it's a story actually I share with my board of directors. So 5 or 6 years ago, we were in New York, and I had not met the princess. And it was at a Clinton Global Initiative meeting, and it was a small group, and we were all together, and I was fortunate to be invited, and she was on a panel with Francis Collins, the director of the NIH, okay? And Francis Collins, who commands an audience wherever he goes, if you don't know that, he's an individual that most people highly revere, particularly after the human genome was cloned. But Francis was on the panel, and this was a panel about breast and cervical cancer, and so I had the opportunity to be there to discuss some activities. And lo and behold, this incredible change agent emerged. And I don't think he got a word in edgewise that night, because Dr. Collins realized that the loudest voice in the room wasn't somebody who could expel the science. The loudest voice in the room was somebody who was a change maker, a person who wanted to do something, a doer. And you said something earlier in your speech, which I think is very compelling. And that was, without a plan to fail. Isn't that right? Without a plan to fail. So we have to have a plan. And in fact, it's part of the fabric of us as ambassadors for medical care to make sure that we provide that vital cog in the wheel for diagnostic medicine. And we're very pleased that we can support the UICC on these initiatives. And several years ago in Paris at the UICC meeting, I was drawn into a meeting and they said, all right, Holiday, is ASCP going to commit to support UICC on the diagnostic side? And there's 2 people that I've met in my life that I can't say no to. One of them is this lady, okay? And the other one is Paul Farmer.
Yeah, Paul.
And both of those individuals have one central theme in their life and their mantra that they believe in, and that's compassion for other people. And they put themselves behind everybody else's compassion. They absolutely take a back seat to what's better for other folks in the world. And for an individual who comes from maybe, arguably, one of the most beautiful countries in the world, to take up the harness of this particular compelling issue, we cannot thank you enough.
Thank you. Thank you.
So let's get started for a few minutes here. I would like for you to talk to our members, explain to the audience, tell us about your country, a little bit about your country, and tell us a little bit about your family as well. Give us some interesting tidbits.
Well, first of all, you should all come to Jordan. I've heard, I think Lottie is coming to Jordan, she said.
Good.
No, not Lottie, somebody else, I can't remember who told me. He's coming soon. Actually, no, Nam.
Nam, yeah,
Nam
sure.
is coming to Jordan. And it's coming at the right time in September. It's lovely. We have one of the best climates in the world. It's a hot country, but it's dry heat. We have, which is unlike here. And we have snow, but it only comes for 2 minutes, 3 days or something. And the whole country stops at a standstill, and we love that. The schools close, everything closed, but then, you know, it comes back. We have Petra. It's one of the miracles in the world, the wonders of the world. And we have so much history. We have the baptism site, where people forget, by the way, that Jesus is in our countries. He looks like me. He doesn't look like you. Yeah. So we have the baptism site. We have so many biblical places. We have the Dead Sea. Our people are really hospitable and friendly. Whoever comes to Jordan always adds a couple of kilos because we love feeding our guests. So you should all come. It's a very safe place, and you will love it. You will love it. There's lots and lots to do, adventure tourism and so on. And many movies have been
Indiana
photograph.
Jones and the
Indiana
coming
Jones.
right out of Petra.
And the latest one with Matt Damon, the one with the, what's it called? He went to space. What was it called?
Right.
That one.
Right.
It's that's in Wadi Rum, which really looks like the moon, actually, and people do camping and so on. So I would really love you all to come there. Now you have a friend over there.
That's correct.
So anybody who comes is welcome. About my family, I have a wonderful husband, and you really need a wonderful husband to be able to do this. If you don't have a supportive husband, forget it. And he's really fantastic. And he is also very much, he was the ambassador and still is the ambassador for the Convention of Clearing Landmines. And at the same time, he is now in the Higher Council to promote the rights of disabled persons.
Right.
So he's very much in that battle as well. And actually, most people in the royal family, they're all sort of hard-working lots and really taking up causes and working hard to facilitate as much as they
So
can.
public service is
It's
in
big.
your it's in your
It's
it's in
big.
your blood.
It's big, yeah.
Right. You know, we grew up knowing and learning about your country through King Hussein and
Yeah.
Princess Noor, and we grew up understanding the compelling issues that are occurring in the Middle East, and it's truly mesmerizing to listen to what you've been able to accomplish and how you have transformed not just your own country, but taking those lessons learned and paying it throughout the field. And we obviously would like to continue to support, but I guess our question is, if there was one big or more important need to fulfill a gap that's currently missing, okay? One thing that, even if it's not pathology or lab medicine, one thing that we can do to help you in your vision, in your future, to make this a reality, that there's cancer care for all, what would that one thing be?
With UICC and our
course,
work,
yes.
I think you could definitely scale up the wonderful work that you're doing in Africa with telepathology and so on. I think that would be really amazing. Imagine having that. Imagine every country knowing that all you have to do is get that machine and be able to get sophisticated diagnostic services. You could scale up the training. I heard from one of your board members that many young people would love to do more global work. And again, they are ready and willing, but how to organize that in a sustainable way, I think you could do that. I mentioned earlier, I wonder if that sounds sensible or not, to work on an essential laboratory list.
Right.
So that people in the development don't go and waste their money with these expensive equipment that gets dangled before them by certain companies when they know they can't handle them or they don't need them necessarily.
Give us a number. How much money do you need?
How much money?
Yeah,
as
how
much
much
as
you
you
want?
have. How much do you have?
Let's just put a stake in the ground.
Yeah.
$100 million, okay? Let's make it happen.
Yes, it will be great. It will be great if you have that.
All right, we've got a marching
But
orders
you
now.
know, all what you're doing, the technical in-kind donation, that's very appreciated. But more, if you can scale up more and more, imagine what more can we do. And I love the fact that you work with others and you recognize when you see a certain program that's really logical and doing things differently, like the City Cancer Challenge, like our work with UICC, to really continue doing that, to be able to, make more impact.
Well, it was a Herculean efforts that our board of directors sanctioned us to commit ourselves to making a difference, and it happened about 6 or 7 years ago. And there was a decision, an effective decision, that we can't stand back and look internally anymore in our own country. We have to commit to our patients across the world. And so this is why we were happy to support the Obama administration, the White House. And in fact, Dr. Milner, who is our chief medical officer, still spends a great deal of time. You think we travel. This guy literally lives in an airplane. A great deal of time helping us move those needles forward, as you were describing.
Yes.
But mostly looking at those systems, because it's the system integration. So if we go in and we map out a plan for you, and then we work with the City Cancer Challenge, it's analogous to what we're doing in Sub-Saharan Africa. And I had the opportunity to meet Carrie Adams, who's now Dr. Adams, who's bestowed several honorary doctorate degrees. who is the CEO for the Union for International Cancer Control many years. We invited him to the White House. He transposed his birth date, and the Secret Service wouldn't let him in, okay? So Kerry then spent his time beating me up that we were never going to meet the Queen of England, but we now have to come over and support the City Cancer Challenge. And I said, Kerry, we're right in line to support you from the beginning.
Yes.
And this is a commitment. So if you were to think 10 years down the line, just think 10 years forward, what is your vision? What do you want to see happen?
Yeah. First of all, I would like to see that there will be no need for UICC, so that we would be out of business. Hopefully cancer would be, you know, conquered and finished, that's one. But also I would like to see more of us organizing our work, uniting. Again, I repeat again, we have a case where we know what needs to be done. We have the tools, we have the medicines, we have all of that. But somehow, how to operationalize it on the ground, how to systemize it, how to even organize ourselves, the global community, to make a bigger impact. That's what I'd like to see, connecting the dots. We don't want to invent something new, it's all there.
Right.
But how to coalesce together to really make a scalable impact. That's what I would like
Well, we
to
stand
see.
committed, and all you have to do is ask.
Yeah?
All you have to do is ask. So one final question before we wrap up, and then we're going to have an opportunity to have a little special presentation. Are you sure you don't have a magic wand?
I don't have,
I thought all princesses had magic wands. Okay? Are you sure? Because I think you've just captivated this audience with your stardust. Hasn't she? Please give it up
Thank you.
for our princess,
Thank you.
Dina Mired.
Thank you so much. Thank you, Claire.
So it is, in fact, a privilege and an honor for us to bestow upon you the 2019 ASCP Patient Advocate Award. This is an
so nice.
international award for individuals who transform the advocacy for global health care, to fight cancer throughout the world, and support moving that needle forward as you described. So, Mr. Jacobs. Whoops.
Oh, wow. This is lovely, lovely. Oh, thank you so much, Jeff. It means a lot to me. Thank you so much. Thank you so much. Very pleasant.
And this beautiful award actually, as our friend Jeff Jacobs described for us, spins on its globe. Who else could spin the world than you?
Oh, thank
Thank
you
you
so
so
much.
much.
Thank you, Blair.
Thank you
Really,
so much.
really lovely. Thank you so much.